Good afternoon and welcome to today's coronavirus technical briefing. Today, the Minister of Health, the Honorable Kim Wilson, is joined by the Chief Medical Officer, Dr. Ayo Oyenloye, and Dr. Wesley Miller, the Chief of Staff of the Bermuda Hospitals Board. We begin today's press briefing with remarks from the Minister of Health. Minister.
Thank you, honey, and good afternoon, everyone. Regrettably, I have to begin my remarks by sharing some sad news with Bermuda that we have recorded another coronavirus-related death since our last update. And I'd like to extend on behalf of the government and the people of Bermuda our sincere condolences to the family and friends for their loss. This unhappy news reinforces for all of us that unfortunately the pandemic is still with us and will be with us for a long time, both locally and globally. Notwithstanding the fact that our number of positive COVID cases is declining and we are doing better, we must keep our eye on the ball and not become complacent. While the regulations are being relaxed today, this does not mean that we can all let our guard down. As a reminder, from today, you must wear a face mask indoors when the following situations occur: traveling by bus or ferry, excluding the outside decks, taxi, limousine, or minibus, both passengers and operators, working in or visiting health service providers such as doctors or dentists, nurses, physiotherapists, occupational therapists, etc., and health services such as the hospital, dental facility, laboratory, residential care facilities, etc., whilst visiting or working at correctional facilities and inside the L.F. Wade International Airport building. Although those are the only places where masks are mandatory, the Ministry of Health strongly recommends that every business owner or operator, event venue, church, etc., have a clear policy regarding mask wearing for their premises. Your mask policy can apply to either your staff or your customers or both. Assess the situational risk involved and develop an appropriate mask policy with safety as the number one priority. Legally, each business can set its own policy and refuse service to those who do not comply. As I said many times before, the pandemic is not over and the public health emergency is ongoing. Unfortunately, 40% of COVID-19 cases have no symptoms, and the symptoms that are experienced are easily confused with allergies, the flu, or the common cold, making it very difficult to identify. The virus is easily spread from person to person, even from someone who has no symptoms, and positive cases among staff and customers often results in business interruptions. Masks effectively control the spread of the virus, and anyone who wishes to wear a mask should wear one, especially when physically distancing is impossible, whether you're indoors or outdoors, when we are around people who we do not know well, or when we are in poorly ventilated settings. Wearing a mask is vital for people who have compromised immunity or who are unvaccinated. Remember, the COVID-19 virus is easily spread from person to person by small virus-containing droplets that are exhaled when an infected person is speaking, singing, coughing, shouting, sneezing, or just breathing. As we learn to live safely with COVID, the Ministry of Health has several recommendations to assist the community. Where you can, hold events outdoors. If an event must be indoors, ensure that it is a well-ventilated space where windows and doors can be opened, and this includes the cabins on boats. Make sure there are adequate supplies available to support healthy hygiene behaviors, such as soap and water, hand sanitizer containing at least 60% alcohol, paper towels, tissues, disinfectant wipes, and no-touch trash cans. Try to always know your status. This can be achieved by taking the COVID-19 test regularly using an at-home antigen test. Businesses are also encouraged to include regular testing in their office policies. Partygoers are advised to take advantage of the home test too, so you can know before you go out. What many restaurants, gyms, offices, shops, movie theaters, and places of worship have in common is that they can be crowded settings where people from different households mix together. These group settings are at a higher risk for the spread of infection. Although contact tracing will no longer be required, it is still helpful for businesses to develop a contingency plan to support contact tracing and notify the Department of Health of any cases of COVID-19 at their establishment. This involves having customers at their premises sign in and provide the following contact information: their full name, their date and time of visit, and a phone number and/or an email address. Before I end, I want to remind everyone that there are steps we can all take as individuals to help prevent the spread of the disease and keep ourselves and others in our community safe. We can wear a mask, especially in crowded places, indoors and outdoors, where we cannot maintain an appropriate physical distance of 6 feet. We can keep an appropriate distance from others who are not included in our party as much as possible. We can wash our hands frequently and properly, or if soap and water are not available, use hand sanitizer, and avoid crowded indoor venues, crowds of people, and settings where we are in close contact with others. As another reminder, although the Pier 6 vaccine clinic finishes up today, we will continue the 4th dose booster clinic at the site of the former art gallery and in Christen's, situate at 71 Front Street, across from the number 5 parking lot, starting tomorrow, Friday, the 1st of April, and the hours of operation are 12 noon until 5:30 p.m. This is available until the 15th of April, and you must make an appointment as there will be no walk-ins. Unfortunately, there is no convenient access for wheelchairs, so clients who use wheelchairs should be accommodated by their physicians, or they can attend the Hamilton Health Clinic, where appointments also are required. I would like to take this opportunity to thank the Christen family for quickly working with us and allowing the government to use their premises for continuation to conclusion of our mass vaccination program. Please note that there are enough supply of COVID vaccines to meet the current demand. However, we strongly advise everyone who wants to receive the vaccine or is eligible for the booster to register online as soon as possible or call the vaccine hotline on 444-2498, selecting option 2. One final note, as of today, the COVID-19 Crisis Relief Emotional Wellbeing Hotline is closed, and I want to sincerely thank Dr. Allison Daniels and her small team that endured for the past 2 years and provided assistance through this hotline, and that opened in April of 2020. So thank you very much to Dr. Daniels and her team for providing this very valuable service. Remember, living safely with COVID means we must continue to follow public health guidance and get vaccinated and boosted. Thank you.
Thank you, Minister. And we'll now have a few words from Dr. Lloyd.
Good afternoon, Bermuda. I'd like to start by echoing the minister in expressing my condolences to the families of our most recent COVID-19 deaths. This is a reminder that this pandemic is not yet over, and we all as a community continue to bond together and grieve with those who've lost loved ones. And as the minister said, we're fortunate that we're beginning to see a dip in the number of active cases that we're seeing on Ireland, and that is good news indeed. Although the numbers are still quite volatile, and we need to remember that we need to be proud of what we've been able to achieve with the level of vaccination that we have been able to get. That is among the best in the world. And we've been also able to prioritize our most vulnerable within our society, giving us that added level of protection. So we really should be proud of ourselves. In addition to that, we now have therapeutics on Ireland, the availability of some antivirals and some monoclonal antibodies for use in the people with the at highest risk. And we are expecting more supplies of this in the next couple of weeks. Echoing again the minister, I think it's important to re-emphasize that while the mask mandate is gone, it is still important that you protect yourself with good quality masks when physical distancing is not possible. Remember, this virus thrives on human contact, and you need to protect yourself when you are in positions where you're not sure that you can maintain physical distancing, and particularly when you are with people that you don't know their status. It's also important that we protect the most vulnerable in our society. And this includes young children, includes the elderly, and also those whose immune system is not able to mount as good a response to this as the rest of us can. We can do this by wearing masks when we're around them, and also by making sure we do a simple home antigen test before we go and visit vulnerable loved ones. And this means that even if we are carrying the virus and we are able to shake it off, we don't pass it on to someone who is less able to shake it off. So I'm hoping that we will have a good summer and spring this year, but I need to remind us that we are only one variant away from going back into an outbreak. So we cannot afford to completely let our guards down. We just need to be quite cautious going forward. And the measures that we have advised people to use over the last 2 years remain effective no matter the strain of virus that we have. In closing, I'd like to thank all the staff who've worked tirelessly across health to be able to make it possible for us to be where we are today. I met with some of my colleagues earlier on today, and I expressed my appreciation to them. To everybody who's done work for us in health, in the police, in national security, at the hospital, at the Department of Health, at the Ministry of Health, in the corrections facility, across the uniform services. I want to say thank you. I want to say that Bermuda owes you a great debt of gratitude, and we could not have done this without you. Thank you all.
Thank you, Dr. Ayo. And now we'll hear from Dr. Miller.
Good evening, Bermuda. As we move to another phase in dealing with COVID, I would like to thank the Minister and Dr. Ayo, the entire team at the Ministry of Health, the Health Council, and the many other organs of government that participated, from people in the regiment, people in other security services, in managing the various waves that we've had and managing in such a way as to prevent the hospital being overwhelmed. It would be remiss if I did not also say thanks and give credit to the many volunteers who went forward in the vaccination program, and including some of the physicians in the private sector who gave of their own time and their best efforts. Importantly, we must also remember the many companies that made significant donations that made it possible, both in terms of assisting with vaccine supplies, as well as the great help that they offered staff at BHP and other people, many who prefer to remain anonymous. We are happy that the numbers are falling in the community, and also happy that the numbers are falling within BHP. In fact, we have very few cases now, and the trend is moving in the right direction. Nevertheless, we have to remain cautious because, as Dr. Aya pointed out, we're just a variant away from trouble. A new variant could emerge at any time. And so we must let caution be the byword. Although it's no longer mandatory to wear masks in certain situations, if there's any doubt, let caution be the byword. Wear the mask. Also, even in instances where you don't, when it is possible to social distance, do so, and at all times, wash the hands frequently, and when it's not possible to wash the hand, use hand sanitizers. These will always be useful because not only will these latter techniques of frequent hand washing and sanitizers prevent the rapid spread of the virus, but it also helps in terms of preventing transmission of other infections. So it's a general good practice to maintain. Now, the fall in the coronavirus has offered opportunities for everyone, certainly within the business community, within the various trades, and certainly in the hospital setting. It puts us in a position where we will be able to maintain normal services. And indeed, we have increased activity in the operating theater because we recognize, like so many other places, we had a backlog because COVID meant that we had to divert resources to deal with the urgent situations that we had. Now we're in a better place. We're able to go back to in-person clinics as opposed to remote, and leverage all the advantages. And this is also, we find that the morale of staff remain high throughout, and one must thank all of them because it was particularly stressful for so many. But even for the staff, I must remind them that while they're now able to take holidays, and some were not able to take holidays despite working long hours, when they go on holidays or when they party as the Easter holidays come up, let caution reign. Where it's possible to have events outdoors, have them outdoors. And if it is not necessary to be all bunched up together, don't do it. And as the minister and Dr. Ayo points out, where in doubt, when you're with a group of people who you don't know very well or they may seem symptomatic, don't hesitate to wear your mask. So always take it around so that in instances where there's any possible doubt or concern, you can use your mask. Always take your hand sanitizers. It doesn't mean that a change in COVID regulation means that you should throw everything out. Certainly don't want to do that because we want to be in a position now where more and more we can go back to enjoying normal life with the proviso that we maintain caution all the time. Thank you very much.
Thank you, Dr. Miller. We will now take questions from the media, and we'll start with Maya Palacio of Media Maya.
Good afternoon.
Good afternoon, Maya. We can hear you and we can see you.
Awesome, thank you. My first question is basically, how long will the no mask proposal happen? Like, what would take the government to bring back masks? Like, what number increase?
Hi, Maya. Good afternoon. As we've spoken about before, there's not a magic number. When we look at public health provisions and what's necessary to ensure public health and safety, we have to look at a number of indicators. One of the indicators, of course, is the level of infection within the community, the level of transmission, whether or not a particularly hard variant is present. I mean, there's a number of variables, so it's not a magic number. We review this. The Cabinet COVID Committee subcommittee meets still regularly, and we just have to constantly review what the indicators are to look at whether or not we have to apply different restrictions or more restrictions or public health measures, to ensure that we can help minimize and reduce the spread. I don't know if you want to add anything to that, CMO?
You're absolutely right, Minister. There isn't a magic number. We have a basket of indicators that we have in the matrix that we monitor every week that allows us to be able to say if things are going in the right direction or in the wrong direction. So that takes into consideration not just the number of infections, but also the impact on services, including admissions to the hospital. Crucially, we also look at what types of variants we're dealing with and how much of protection we are getting from vaccines and from previous infections. And also the therapeutics that we have on island that I mentioned earlier on. So all of these are in a matrix of indicators that we look at, and it's not a simple number.
Okay, thank you very much. My next question, if I remember correctly, the last press release on March 28th mentioned that the vaccines will also be given at pharmacies and it will possibly come at a cost. By any chance, would you know the number of that cost and whether or not insurance will cover or which insurance might?
The cost is $29.50. However, as I understand it, that copay will only be for persons that are insured under GEHI. The other insurance companies are covering the cost 100%.
Thank you for that. My next question.
Sorry, Maya, $29.95, not $29.50.
Okay.
Sorry about that.
$29.95. All right. Thank you very much. And my next question. So, for example, if a company wishes to continue with the mask wearing in their establishment and persons do not wish to comply, what steps can the business take? Like what type of confrontation would that lead to and what can they do about that?
Well, hopefully it won't lead to a confrontation. That's a very important question. I thank you for asking that because as we've indicated, it is up for the businesses to set their own policies as it relates to mask wearing, either for their staff or their clientele or both, and they need to assess their risk and see what they're comfortable with. It's not dissimilar to an establishment saying no shirt, no shoes, no service. So they can likewise add mask in, and if a person doesn't wish to comply with that, then the business has all the legal authority to refuse service to that individual.
And my final question, you mentioned that the hotline is now closed. Can I ask what was the cause of that, and also what were the latest numbers on the use of it? Like, was it just not being used enough and that's why you basically shut it down?
Okay, it's not the hotline. Actually, that was a mental health service that was being provided by the Bermuda Psychological Association, and they've been doing it for 2 years on a voluntary basis. And it does end today. And again, I have to thank Dr. Allison Daniels and her team for providing that service free of charge to members of the community. However, recognizing that if there are individuals that are still desirous of requiring any type of support or want to speak to somebody because of challenges that they may be having mentally, then by all means, they can continue to utilize the services at MWI. I'll yield to Dr. Miller because I want to say the numbers. I don't want to call it, but it is a number. Maybe Dr. Miller knows the number, but it certainly is a free service that persons in the community are still allowed, able to avail themselves of. I just don't know the number offhand. Thank you, Maya. But it's not the hotline, the COVID hotline, not to be confused. That is a very important service that continues to operate.
Yeah, and Maya, if people are concerned, they can certainly call us at BHB. We have a number they can call, which is 239-1301.
Thank you, Dr. Miller. But I just want to reiterate, do you know the number of the last, like for the month, possibly of how many people actually called the mental health hotline? Well,
I don't have that information, Maya. I'm sorry. Don't know.
all right. Okay, well, thank you. Those are my questions.
Thank you, Maya. We'll now take questions from Gary Foster Skelton of the Bermuda Broadcasting Company.
Good afternoon. Can you hear me?
Yes, Gary, we can hear you. Thank you.
Thank you. One moment. Thank you very much. I'm just bringing up my screen now. So, thank you, Minister. Thank you, Dr. Oyenloye and Dr. Miller. Now, you have said that you expect cases to rise. We're currently seeing more than 200 new cases every week and on average a death every week this month, another announced today. Judging by what we have seen overseas in the UK with the dropping of mandates, by how much do you expect cases, hospitalizations and deaths to rise?
I can have a go, Minister. It's not an exact science, as you would appreciate. I'm sure you appreciate, Gary. It's not an exact science, and there are several factors that come into play. So what happened in the UK following the removal of some of the public health measures that they had was up to 40% climb in cases. The hospitalizations was much more modest, but it coincided with a period of winter pressure. So even though the hospitalization increase was modest, the winter pressures sort of made a bad situation worse. So we can only go by what other areas have seen, and we expect to see increased cases. We expect to see a slight increase in hospitalizations as well, where as Dr. Miller would no doubt tell you, the hospital is well positioned to be able to deal with the expected increases. As mentioned at the last teleconference, we now have new therapeutics and are expecting even more antivirals on island that will help us to intervene earlier and prevent even more hospital admissions. But all of this is on the premise and on the assumption that we don't have another variant that makes all these assumptions irrelevant. So I'll hand over to Dr. Miller, who will tell you all the preparations the hospital have in place to deal with that.
Yes, in terms of the hospital being overwhelmed, we have plans because we have been through the drill before, so that the main area of concern would be how many severely ill patients we can take, because as you know, the vast majority of patients who turn up will be treated and they can be monitored at home. But there's a certain proportion who we would have to admit. And of those, the ones we concern ourselves with most would be those who require intensive care. We have an 8-bedded intensive care unit, but we also have the ability, which we have done before, to create 2 satellite units. So it puts us from a position where ordinarily we would have a maximum of 8 beds to where we can easily have 20 beds. And even beyond that, if we were to get beyond that stage, our challenge would not be beds or machines because we have enough ventilators. Our challenge would be staffing to provide for all of those. Notwithstanding that, we're in a much better position today than we were with the previous variants because we have a much higher proportion of vaccinated people within the population. Also, there is greater understanding among the population, and I must congratulate the Bermuda public because they have behaved with restraint and discipline, and I expect that we will continue to see that cooperation. So with those things in mind, and added to the fact that we also have adequate supply of medication and a few more in the armamentarium, then it gives confidence that we will be able to handle whatever comes down the road.
Thank you, Dr. Miller and Dr. Ainley. I understand, Dr. Miller, that it's not an exact science, but you have made, Minister made a concession that there are going to be deaths. We have seen cases rise overseas. Is there any expectation of a percentage rise that you think this is what we think will happen?
No, whereas I anticipate that we may have a small number, I'm not looking at a significant percentage increase. And you will also notice that if we were to take the period, say, February through to March, if we compare that with the times of, say, September and October, or late August through September, the situation is quite different. Instead of maybe one person occasionally, we were at a situation where there were times when we would have 3 in a day, and then 2 in another day. So in the amount of people that would have died in a week during the worst of times, we haven't seen that, say, in the past month. And also, one of the things is that I always say to folks is that understanding and the education and their behavior change things. In the beginning, people didn't understand as much about it. And also, they just didn't have the vaccines. And then when it came, there were some people who were reluctant. So it took a bit more time to persuade them. But thanks to the churches, the unions, the various organizations, because it was not just the physicians and the nurses. Thanks to you also in the media who have been very helpful, more people gradually signed on to have the vaccine. So we're in a better place now. Do we have 100% vaccination? No, we would like that. Are we still encouraging people? Yes, we definitely will be. But we're in a much better place in terms of vaccines than we were. And in addition to that, we have had booster doses in a high proportion of the more vulnerable individuals. And we're now even in the situation where they can have a 4th dose for certain vulnerable groups. So taking that into consideration, along with the fact that there's much better understanding how to protect themselves, I'm not expecting a high proportion of deaths. We can never say there won't be any because it's an inexact science, but with enough precautions on the part of others and with others of us doing our best, and also with the good work that the press has done for us in reminding people that this is not a problem of the past. It is something that we try to live safely with, but we have to maintain caution. And with that taken into consideration, we don't anticipate disaster, but we are prepared for the worst.
Thank you, Dr. Miller. My next question is for the Minister of Health. Minister of Health, both you and the Minister of Education have conceded that coronavirus cases will rise in society, in the schools. What then are you going to do about an inevitable rise in quarantines and isolations and people who cannot work due to this? Will you change the rules so no close contacts at all have to quarantine, or will you require positive cases to isolate for a shorter time?
Well, Gary, as I indicated, the Cabinet Subcommittee on COVID meets very regularly, and both myself and Minister of Education, the Honorable Jill Rebane, are also both members of that committee. And as you've seen in recent months, as we've, as a cabinet and as a country, adopting processes and procedures of learning to live safely with the COVID, we have also, you would note, changed the not only the border policies as it relates to what's required to enter, but we've also changed the regulations and the timeframes for persons that have to quarantine and or isolate. So all of that has been a moving target, recognizing our level of immunization, recognizing our risk tolerance and the like. So even as we speak now, the time period for immunized individuals to quarantine has been reduced if you're not having symptoms and so forth. So we constantly look at that. I'll invite the CMO to speak more generally about the quarantine, the isolation rules as it relates to our current phenomenon. But the reality is that we've moved quite away from, initially it was immediate 14 days quarantine. Now, depending on your status with respect to whether you're immunized or not, depending on whether or not you have symptoms or not, the time period for quarantining and or isolation has changed, bearing in mind where we are with respect to our high immunization levels as well. So I'll yield to the CMO, but again, it's important to recognize that COVID is with us, and the Cabinet Subcommittee does meet regularly, and we review the situation. We get further information about the metrics and so forth from the ministry here and make determinations, but we're not where we were 6 months ago, let alone 2 years ago, as it relates to the time period persons are required to isolate and or quarantine given our current status.
But you have acknowledged that we're entering a phase now where we are almost accepting that there is going to be a rise in cases. And therefore, that will automatically, even if we have reduced quarantines, we reduce quarantines and isolation times under previous restrictions, mask mandates, etc. Now those mask mandates are being dropped. That means, according to you, we are expecting more cases, isolations, quarantines that will be inevitable. And are you preparing more financial assistance for those who will not be able to work, parents who have to stay home because their children's class is on remote? These things, from what you're saying, are bound to happen more regularly over the next month or two.
I'm not sure I would agree totally with that, because again, we're in a totally different, we would anticipate that there will be rises of cases. However, we are in a totally different situation than we were even 6 months ago with the level of immunizations. You would note that we have passed legislation that is allowing an extension for various benefits and circumstances of persons that are unable to work due to COVID up until the end of August. However, the quarantine provisions as well as the isolation provisions have been relaxed, bearing in mind where we are as a country, particularly when you weigh it against the level of immunization that we have in the country.
Okay, but you're saying that isolations, quarantines, those are you've relaxed them as far as you're going to at this time.
That's correct. At this time, correct. But okay, as the CMO will elaborate on more, but the reality is there is a moving target, and we are reviewing this. Today, we're saying that the mask mandate has been rolled back, but it's not to say that in, God forbid, 6 months from now, if another variant comes and circumstances are changed, then we will have to look at adopting more public health measures.
Okay.
CMO?
Yeah, absolutely. Yes, Gary. So I've explained this before. If you have, when we talk about the wild type of the COVID-19 virus, it had a predilection. It prefers the lower parts of the airway, so inside the lungs, and that's why it had so much of COVID pneumonias earlier on. The subsequent variants started having more predilection for the upper part of the airway, and that's why they were more transmissible. But they still kept the predilection for the lower part of the airway. What's happened with Omicron, for some reason, it's less, it doesn't like the lungs as much as it likes the upper part of the airway. So you have more of it in the upper part of the airway. That makes it super, super infectious in order of 10 times the magnitude of what we saw before. But the advantage to us, if you could call it that, is that the quarantine period is shorter. You can actually, most people, once you are exposed to it, you get to develop your symptoms much more quickly. So that allows us to be able to reduce the quarantine period, given the type of virus that we're seeing, to what we think is much more appropriate on the population level. There's always, when we're dealing with populations, there will always be outliers. People who get it much sooner than what we expect, and people who get it much later than we expect. But the bulk of the people have a shorter incubation period. The other thing we've found out is that for immunocompetent, fully immunized people who are able to mount good antibody response, it's not inevitable that they will develop a disease. And this is the advantage that allows us to be able to monitor those people on a daily basis with lateral flow tests and allow them not to have to quarantine. So that is the other thing that we have in place that we didn't have in place before, because of the level of vaccination that we have and the level of the way the virus behaves now. So that allows a little bit of flexibility. But I do take your initial point that we expect to see more cases. And that will inevitably mean that people will need to isolate more. Their close contacts, fortunately for us, because of our level of vaccination, we can actually do what we used to call the workplace quarantine or test to stay in schools, that allow them to get on with their lives as long as they're testing more frequently. That allows us the confidence that we are protecting the rest of the public.
Very well. Thank you, Dr. Oyenloye. My final question is to you, Dr. Oyenloye. You did say more supplies of COVID drugs may be coming. Last time we were here, you said a supply of Pfizer's COVID drug Paxlovid would be made available to us from the UK. Any more details on a timeline on that?
Yeah, interesting you should mention that, because I spoke to colleagues in the Department of Health and Social Care on Monday, and they assured me that they passed it on to their shippers. I don't have an expected date of arrival yet, but our allocation has been passed on to the shippers to bring to us in Bermuda. So anytime from now.
An allocation, could you clarify, did you say how much?
So we have, I don't remember the exact capacity now, but the UK government has allocated 1% of all its stocks for its UK overseas territories. If I remember correctly, we have just under 500 doses for Bermuda for the Paxlovid, and about the same number for Molnupiravir.
Okay. Thank you, Dr. Oyenloye. Actually, I don't know if that was my third question. If you do have for one more question, Minister of Health, will there be additional staff hired at MDL to assist with testing, etc., to manage the rising cases that you are expecting?
As we've spoken about previously, Gary, we have transferred to antigen testing. So the majority,
So-
virtually 90% of all the testing that takes place is through
Self-reported.
Correct.
Right. Okay. Thank you, Minister. And
Thank you, Gary. We'll now take questions from Jonathan Bell of the Royal Gazette. Hello, Jonathan, we can see you.
Hello, can you hear me?
Yes, we can. Thank you and welcome.
Thank you very much. Sorry, I'm on an unfamiliar laptop. I know it's a lot of clicking around. Well, we're back again. And thanks as always for having us. I will get to COVID, but first I had a few questions that I think need to be asked. Minister, Renee Ming resigned yesterday. I wanted to ask you, were you surprised? Is there dissatisfaction with the Premier or other ministers likely to go? And what's your position?
Jonathan, I can understand that you would like to ask questions like that at today's press briefing because there are a lot of topics that are currently in the news. However, today's briefing is intended to deal specifically with the health and safety of our community as it relates to COVID, and I'll be addressing that. I cannot comment any further as it relates to the circumstances that took place yesterday, except for to refer you to the statement of the Premier.
I had other questions on the topic, but from the sound of things, Minister, that's as far as you're willing to go on that one. Have I got you right on that?
Yes, you did.
Everyone, I just got a call on this computer, so my video has gone down. Apologies for that. I take it you can't see me anymore.
We can see you perfectly.
Okay, I can't see me. At the last time we were all together here at this press conference, I was doing a lot of asking about the equipment and the means to check out these subvariants. I wanted to ask if there's any evidence of the BA2 Omicron subvariant in Bermuda. It's reported to be dominant in the U.S. Is it here, and what's our capacity for being able to find these variants and subvariants? A couple of folks here today have said that we're one variant away from an outbreak. So that's the topic I was hoping to revisit. Perhaps yourself, CMO?
Yep, I'm happy to answer that. In constant communications with colleagues at the MDL laboratories, and they've been doing a fantastic job so far. We have issues with some of our equipment, so that limits how much typing we can do, but that is being addressed as we speak. To the specific question about deep sequencing, genetic sequencing of the lab variants that you're talking about. So yesterday I received confirmation that colleagues in the CALPHA laboratory in Trinidad and Tobago have received our latest samples that we sent to them. We're expecting them to do the sequencing soon and give us the results. We also have a collaboration with the New York Genomic Sequencing Center. We just basically, because we're reviewing everything now, we're getting lawyers on both sides to look at their agreements to make sure that everybody's happy with what we're doing together. So that process is ongoing. I expect that to be sorted in the next couple of days. And once we have that in place, we can send samples to New York as well. And that we found to be quicker than sending it down to Trinidad. So that is about capacity. Your other question was about if you have the BA2 variant on island. Because we have not been able to do the sequencing recently, we don't know for sure. But basically, based on the epidemiology and the way the virus is behaving at the moment, I'll be very surprised if we don't have it already in Bermuda. The sort of spread that we've been seeing is actually very, very rapid, which is what other colleagues across the world have reported about BA2. So I am behaving, and the whole team is behaving as if we had it on island. We'll also be able to confirm that in the next couple of days once we get the results from CALPHA, that whether or not we have it on island. But my assumption, fine assumption, is that we do.
CMO, appreciate you.
Yeah.
Yourself and perhaps Dr. Miller, I know I often harp on this, but I do need to ask, what can you tell us? What are the age ranges and vaccine status of the recent fatalities and people in the hospital that we've been seeing with COVID?
I don't have the most recent figures at hand, but you also would understand the sensitivities around that.
Totally,
the number
yeah.
of deaths and hospitalizations we have been talking about are a lot smaller. So it's extremely easy to identify individuals with that. And I'm sure you or neither you nor your listeners will like your health status broadcast on national TV. So we need to be quite careful about the way we report that.
I understand you, Doctor. Let me see if I have this correct. Now, as of Monday, 10 people were in hospital with COVID. What can you tell us about how many are receiving antivirals, and are these being used outside of the hospital setting? Gary may have touched on some of that, but my audio went out. I wanted to know how many people are receiving antivirals in hospital, and are these drugs being used outside of the hospital setting?
I think I'll leave it to Dr. Miller.
In terms of the treatment of the patients, as you know, for those who are hospitalized, the mainstay would be dexamethasone and remdesivir. So remdesivir is in fact in the category of antiviral drugs. I probably think you are asking about the oral antivirals. The oral antivirals, we've ordered those, but we don't have those in stock. The remdesivir can also be used in settings outside of the hospital, but in practice, they tend to be used in what I would call hospital, or shall we say near hospital type settings. And for the remdesivir and the dexamethasone, sorry, we do have adequate supplies, no chance of running short of those. For those more severely ill, we would need to give them oxygen, either high flow nasal oxygen or otherwise. And in terms of oxygen supply, we're well positioned. We have enough that we can give away. In fact, even during the height of the pandemic, we were able to help passers-by and people who were at sea who had particular problems. We found ways of assisting them. So we've always had enough oxygen.
Everyone, I believe that's my four. Thanks, and Minister, thank you. I hear you. You know, losing a national security minister in a pandemic does raise questions, but I hear you on that. Thank you kindly, and be safe, everyone.
Thank you, Jonathan. Thank you, Minister. Thank you, Dr. Miller, and thank you, Dr. Oyinloye. Minister, do you have anything you wish to say before we conclude?
No, honey, thank you to everyone, and thank you for joining me, Dr. CMO and Dr. Miller. I, again, want to just reiterate to the members of the public that we are still in the midst of a public health emergency. COVID is still with us. We can take steps to learn to live safely with COVID if we adhere to the public health guidance, wear our mask, exercise physical distancing, good hand hygiene, and remember the 3 C's to avoid close contact settings, oh my goodness, avoiding the 3 C's, I'm sorry. And then we can all try to adhere to, again, the public health guidelines so that we can, again, continue to live as safely as we can with COVID. Thank you.
Thank you. Thank you, everyone. And that does conclude today's technical briefing.
Honey, could I just mention something quick?
Yes, Dr. Miller, go ahead.
While we're talking about COVID, I was remiss in not mentioning that there are some people who will have mental health issues related to the stress of the past couple of years, and some of it because of the lockdown or the employment status that may be as a result of COVID. And for those people, we have a separate hotline, which is 239-111. And so that's 239-1111. And that's manned all the time. So I wouldn't want anybody to feel lonely, isolated, and feeling like there's nowhere to go. Feel free to call that line. There will be a sympathetic, professional source of advice at the other end.
Thank you, Dr. Miller, and thank you to everyone today. Good night.
Good night. Thank you.